Hey everybody, welcome back. This is Nurse Eunice. In today's video, we're going to discuss entry-level healthcare jobs that require little to no certification so that you can start working and growing your career today. There was a student who requested this video, so I hope that you're able to watch it and I hope that it helps you a lot. So let's start our introduction. In today's economy, many hardworking people are facing job loss or looking for new ways to earn income. The great news, healthcare remains one of the most stable and rewarding industries, and many hospitals, clinics, and nursing homes are hiring for entry-level roles that don't require certifications. Beyond just the basics, you'll need to know CPR and you'll have to be able to pass a background check because, of course, you're working with vulnerable populations. These positions will allow you to gain experience, earn income, and make a difference in your community. Even better, most healthcare facilities offer tuition reimbursement and on-the-job training, helping you move from an entry-level job into a lifelong career. And now this is a position that in the past, many people would have frowned upon. But look, I was brought up differently. I was brought up that having any job is better than having no job at all. And I remember when there was, she's now a nurse, but she was from Scandinavia. And when she first came to the United States, she started off in environmental services. 2 years later, you all, her English had improved and she was a nurse. So for our EV staff, we appreciate you and we love you. So let's talk about environmental services or the hospital housekeepers. Yes. So what are the duties? You're going to be cleaning and disinfecting rooms and the hospital areas to prevent infection. You help keep the hospital running. Why is it great? It's a vital role that keeps patients and staff safe and it allows the facility to run smoothly. More important than that, you can work any shift, day, night, and weekend. Is there training provided? Of course, because you have to learn about different isolation types. You got to learn about the chemicals that the facilities use. And so it's provided on site, and normally there is no prior experience needed. And if you already have prior experience, well, maybe you want to be the environmental services person who works in like the OR. There are different areas in the trauma unit. Look, they have to clean up the ER. There are different areas you can work. And so if cleaning is your passion, you love to clean, consider working in environmental services at a hospital. Let's go to the next one, you all. Patient transporter. I told you, these are entry level. So if there's anybody in the comments saying, don't do this, don't do that, remember, they don't pay your bills. Ignore them. All right, so patient transporters. I love the patient transporters too. So what do? They move patients between departments or appointments using wheelchairs and stretchers. So they have to be able to move these patients safely. A lot of body mechanics are involved. Why is it great? It's a great introduction to hospital operations and the patient care teamwork. Like I said, we love our patient transporters. So once we know you and we love you, we're always looking out for you. Hey, John, we have a new position coming available. Why don't you get your CNA license? Again, it's just a foot in the door until you figure out where you want to grow from there. Training, similar. Yes, you're going to need CPR. You're transporting sick people. So you'll need basic CPR. And then on top of that, they will provide the training on safe handling of these patients and also basic safety. You'll get that during your orientation. Next, a sitter. Whenever you all contact us and they're like, Eunice, I can't find a job. I'm like, did you apply for sitter or a companionship role? Some of you all don't know that's even a thing. Yes, when our patients are confused, they're trying to get out of bed, we don't restrain all these patients. We don't tie them down. We're going to have a sitter in the room. That is a paid position. So what are the duties? You're going to observe and support patients who are confused, at fall risk, or recovering from surgery. You sit there, you remind them not to get out of bed. You may be able to hand them a few items, but that's it. You don't even assist them to the bathroom. You have to call the nurse and the CNA for that. So why is it great? You get some hands-on experience in patient observation. Remember, you're not doing a whole bunch of direct care, but you're observing them, you're learning terminology, and you get to provide them with the basics such as handing them their water. Training is going to be provided by the employer. So whenever you go to the hospital sites, you're going to go directly to the hospital. Look, stop going on those other job sites. I'm not going to mention their names. Don't go to their sites. Go directly to the hospital. Go directly to the nursing home. Find the website and then look for careers. And then start searching for these positions that are listed in this video and tell them that Nurse Eunice sent you. All right, let's go to the next one. A dietary aid slash nutrition assistant. What are the duties? They prepare and serve the meals, follow the dietary restrictions for the patients, and they assist the kitchen staff. Why is it great? It combines teamwork, service, and patient-centered care. When I tell you we work so closely with the transporters, with the environmental services, with the dietary staff, you all, oh, I'm kind of missing working in the hospital right now. And so it is a great job. Remember, it's a starting point. It doesn't have to be where you end. All right, and yes, there's on-the-job training. You'll get to meet the patients and the residents. You're going to find out their likes and their dislikes. They're going to fuss at you, but then you just come and tell me, and I'm like, okay, um, I'll call the doctor to see if we can get that diet changed. So, but it's a great introduction into healthcare. Next, a laundry slash linen service workers. Some of your hospitals actually, and your nursing homes, they actually have the linen sent out, while others have linen and laundry services on site. So what would be the duties? Wash, fold, and distribute the linens and gowns for patient care. So yes, you would come, you would pick everything up, you would take it down, clean it, wash it, fold it, and then maybe you or someone else from your team would have to come back and restock. So it's always that cycle because we go through so much linens. This is another job that you can probably work multiple shifts for. Why is it great? It's a quiet but essential support role in every healthcare facility. And again, if that healthcare facility doesn't have those services on site, I need for you to research the company that they send the linens to so you can try to get a job there. And of course, orientation and of course, training is provided in orientation. But for those positions, some of these you didn't even need CPR. You just need to go onto the website and apply. You can do it. Next is central supply assistant. You know when your nurse tells you, hey, go get the catheter. Hey, go get this tube. Hey, go get alcohol swabs. Well, someone has to be the person who is stocking the central supply room. And that could be you. So the duties include stocking and distributing sterile supplies and then organizing the inventory. Why is it a great position? Because you get behind the scene experience that helps you to understand hospital logistics. Yes, it's a lot. Imagine working in the ICU and you're the central supply assistant for the ICU or for the trauma unit. You have to know what supplies they're using, where to put. You have to know what supplies you have to know what supplies they're heavily using. If they're asking for something special, you have to get it there. So that's a busy role that does not involve direct patient care. And yes, there will be short on the job training for that position too. Moving right along to non-emergency medical transportation. You know how they have Uber and Lyft? Well, they have something similar for people who need to get to their doctor's appointments. So yes, NEMT drivers, they transport patients to dialysis, different therapies, or to their follow-up appointments. It allows you to have flexible hours and rewarding community service roles. Remember, your dialysis patients, they go to dialysis for 3 to 4 hours per day, and they go 3 days per week. So you could literally have the same clients that you're picking up, getting them to their appointments, and then going back to pick them up from the doctor or from the dialysis clinic, and then taking them home. What an amazing way to show your love for the community than by working as a non-emergency medical transporter. What's the training? Really simple. You're going to have to know CPR. You have someone who has a medical condition in your vehicle. Yes, you may have to have a defensive driving course, but you don't need a CDL. You don't have to go to truck driving school. And because you're dealing directly with patients, you're going to have to be able to pass a background screening. Super easy, right? Research it. Think about technology. In some of our hospitals now, they don't have a unit secretary in the way that we used to have it. Our unit secretaries will be monitoring the telemetry bank, so they would be seeing all the heart monitors, they're answering the phones, and they're assisting the nurses, the doctors, the visitors, everybody who comes in. That was a lot. So what are they doing now? They actually have remote patient monitoring. Yes. So if a patient has a heart monitor, you're not even on the same floor as the patient. You could be in a centralized room in the hospital, or you can be in a whole nother city. Yes, that's a thing. And if something happens to that patient, you call that nurse, you call that floor, and you get someone into that room right away. So this is the wave of the future. Telehealth, tele-patient monitoring. So what are the duties? You'll be reviewing vital signs and health data through telehealth systems. Why is it a great opportunity? Because it allows you to work from home or maybe a hybrid opportunity. In digital healthcare, what's the training? You have to know about confidentiality laws. Look, just because you're not in a facility doesn't mean that you can be going back and talking about what happened to this particular patient. So you are still going to be held accountable. And then you would have to have some basic computer skills. If a company's hiring you for their telehealth, for their telemonitoring positions, they will more than likely ship, mail, have you pick up the computer, whatever technology and equipment that you need to perform your job. All right, so this one may require a little bit of certification, but home health companion slash personal care aide. So even though this one's entry level, it's not necessarily you being a certified nursing assistant. It's the step before being a CNA. And this is state dependent. So don't be like, hey, Eunice, how to become a personal care aide in Florida? There is not a thing. All right, so a personal care aide or a home health companion versus a home health aide. So the duties, you're offering companionship and help with meals, hygiene, and some light housekeeping. In Florida, you have to be a home health aide or a CNA. So it just depends on what state you're in. Why is it great? Because it allows flexible scheduling and fulfilling one-on-one care. Do you all know that for some of these home care residents that you get paid more than you would if you had 10 to 15 patients while working on a hospital floor? So I know a lot of my newbies, my new care providers, you're like, well, I don't want to be in anyone's house. It's boring. Yeah, it's boring, but you get to study. You're looking at Mr. Paul while he's watching TV, and you can literally be looking in your nursing manual and studying and addressing him every time he has a question, seeing if he moves. Hey, can I help you get up? Can I get you some water? Do you want your soup heated now? No, that's an easy position. And what would you need in order to have that position? You need CPR and a basic orientation. Remember, if I'm talking about something that's not in your state, go ahead and bypass it and go to the next one, just like I'm doing right now. So what's next? Hi, everybody. Welcome to Eunice's Nursing Home. Did you know that they have volunteers, but they also have paid staff who can be hospital or clinic greeters and also patient escorts? So whenever grandfather comes in and he has a 6 a.m. surgery, someone has to be there greeting him and putting him in the wheelchair and then whisking him to pre-op holding so that the nurses and the doctors can greet him. That could be you. What are the duties? You're going to welcome the visitors and also the patients, provide directions, and assist the patients to their rooms or their departments. Why is it great? It's perfect for friendly, outgoing individuals. And yes, there's going to be training involved, but that training involves customer service, which I am sure that you're already a pro at. So go get your job, friend. I kind of mentioned this before. I talked about a unit secretary, but yes, you can be the one at the office, the front desk, the medical office clerk slash receptionist. You have to be organized for this. So if you're not organized or if you're not a friendly person, don't even apply. Because I do not want to go to a doctor's office and meet, I hope no one's name is Gretchen on here, but meet Miss Mean Gretchen. So you want to be personable. Hello, how are you doing? Welcome in, sign in. Can I see your insurance card? Things like that. So what are you going to help? You're going to help your physician, help your clinic, schedule appointments, verify insurance, and manage records. But in order to get those records and the insurance cards, you have to be But in order to get those records, you have to be someone who communicates well with others, okay? So why is it a great role? It exposes you to administration. Maybe if you like it, you will go on to school to become a medical assistant. But for right now, you're at the front desk, you get to learn everything and decide if you want to learn more, continue your education at a later time. What will you need for this position? Basic computer and communication skills and to be organized. Nothing worse than someone's calling you back saying, hey, you were supposed to schedule an appointment for me and I'm calling to find out that date. I didn't write it down and you didn't do your job. So if you're not organized, if you're not computer literate, this would not be the best role for you. Did you know that there's somebody who actually scans the medical records? So, yes, they have transcribers, they have people who will take the paper records and then scan them in to an electronic health record. And that could be you. You could be the health information clerk. So, what are the duties? You're going to scan and organize files into digital systems. Why is it a great opportunity? Because it is an important non clinical role that supports compliance and privacy standards. Your training that you'll need, of course, during your orientation, they'll talk about HIPAA, which is the confidentiality law. You'll also need to be able to type maybe 35 words per minute and be able to utilize the hospital's data entry software. Of course, they're going to teach you how to utilize it. But once you have that, look, you didn't have to go to school, you didn't have to go to college, you could become a health information clerk. I don't even know what number we're on, but we're moving right along. So next will be a volunteer or a community health program assistant. For some of you all, you're not, trying to get a job because you need the additional money. You're just bored, okay? Especially if you're retired. So you can be that volunteer. We love our hospital volunteers. And sometimes you're doing nothing more than greeting people or giving them a cup of water. Do you know how that makes someone feel? Do you know how it makes the nursing team feel? Because we're so busy. We have all these patients, and then we see you coming with a water pitcher. Hallelujah. So, what are the duties? You're going to support wellness events, patient activities, or health education projects. And in some of your facilities, you also do little comforts, such as giving people a warm blanket, refilling their pitchers. Why is it great? Because it builds community experience and gives the patient a better experience at the facility. Plus, it can be used as a future reference for you so that you can go ahead and apply for further roles. Look, I've been here as a volunteer for a whole month now. I love this organization. I would love to now become a patient transporter. You see how that works? The orientation that's required to be a volunteer or community health program assistant will, of course, be provided to you during the brief orientation. But that would be a great way to get your foot in the door. Whenever you're online, if you're not seeing these positions at your local hospital or nursing home, don't be afraid to give HR a call. Go ahead and call and see if you can speak to someone. At some point, you have to be able to bypass artificial intelligence. If all you're doing is uploading your resume and never hearing from anybody, that's because you're using some type of broad, global search engine. Go directly to the company's website and apply. And if you're unable to apply for a position that I'm mentioning here, go ahead and call. We previously talked about the central supply technician, but how do the actual items get to the hospital? That's part of the supply chain, you all. And yes, they have inventory technicians for that. So pretty much any packaging, Medline, Baxter, Foley, those items have to get to the hospital. How are they getting there? It could be you who's assisting with that process. And so what would be your duties? You track deliveries, restock supplies, and assist with ordering. Why is it great? It teaches you organization and problem solving in healthcare operations. And there will be on the job training for this too. I've worked in numerous behavioral health settings and I love it. It's so endearing to see somebody who comes in who may be having a mental health crisis who a few days later is able to go back and return to their family. And so you could become a behavioral health observation tech. What would you be doing? You'd be monitoring the patients who are in a mental facility or in a detox unit for their safety and emotional support. Why is it a great position for you? Because it gives you valuable exposure to behavioral and psychiatric care. And so, what training would you need? You have to learn crisis prevention. I'm sure you need CPR, even though it's not included here. and then observation training, which will be done at the actual facility. And so you would be the one who would be notifying the nurses, notifying the techs of some changes within the patient's behavior so they can get in the room and assist that patient. So behavioral health observation tech may be a position that's available in your area. All right, team. So we have talked about a lot. Let me tell you my final thoughts. Starting small doesn't mean staying small. So remember, anybody who's in the chat saying, don't do this, don't do that, don't do environmental services. I know somebody who's working in environmental services making $25 an hour. Yes. Benefits, vacation time, and they don't work every weekend. They work every other weekend. So don't listen to them. You do what's best for you and your family. So again, starting small doesn't mean staying small. So let me say that again. Starting small doesn't mean staying small. These positions can be your first step into the healthcare field, offering real world experience, valuable connections with people like me, and financial stability. Here's an important reminder. Each state and employer may have different hiring requirements, so always research your state's guidelines and apply directly through the hospital, clinic, or nursing home websites for the most accurate job information. And I mentioned this before that most healthcare facilities also offer tuition reimbursement or career ladder programs, allowing you to turn today's entry level job into tomorrow's nursing, medical assistant, or healthcare management career. Locally, we have hospitals who have CNA to LPN bridge programs, who have in house sterile processing programs, in-house respiratory therapy programs. I need for you to get into the house. If I can't say it any louder, get in the house. Get a job in a hospital. Get a job that allows you to use your hands. Yes, AI is coming after a lot of jobs. Do you know who still has jobs? Those who are able to pivot and those who are not afraid to start over again. And my friend, I hope that is you. All right, so here's my final call to action, you all. Are you ready to take your first step in healthcare? No, I don't offer all of those programs, but we do offer CPR, CNA, patient care tech, which is the hospital level CNA. So once you get in and you decide that you want to go further, reach back out to us. You can go to our website, which is fltraining.com for CNA, CPR, and phlebotomy courses, and we have partnered with Career Step for patient care tech, for EKG tech. You can do those courses hybrid. You don't have to come to Florida for those. You can also explore my personal website, which is nurseeunice.com, for free study guides, quizzes, and healthcare resources. Don't forget, if you've watched this long, go ahead, like, share, and subscribe. Let someone else know about Florida Training Academy at Nurse Eunice and about those entry-level roles in healthcare. A lot of people, almost 1 million people, have been laid off. And so, are there enough healthcare positions for everybody? No, there's not. But there will be positions available for those who are able to pivot quickly and who are not afraid to start all over again. Remember, it's just entry level. You're not staying there, you're starting there. My final thought is start where you are, grow from there. Your healthcare career begins today. You know I love you all. Thank you all for watching, and I'll see you in the next video.